everybody, and it's my honor to moderate this session for cardiovascular complications in diabetes as a part of the 16th annual conference, International Conference of the Arabic Association for the Study of Diabetes and Metabolism 2020. I have prestigious colleagues, cardiologists, who will follow the introduction by their lectures, but I will have to introduce an introduction. The session is about the dilemma of diabetes and the cardiovascular disease. We know that diabetes is estimated to affect 9% of adults worldwide. And if you look here for our area, it will be more than 12.5% increase. Diabetes is associated with significant loss of life years here, as the vascular mortality here is more higher in male and females who have diabetes. And up to 50% have underlying heart disease. This is because the progression of type 2 diabetes starts early with microvascular complications before the diagnosis of the onset of diabetes. The cardiovascular disease and diabetes is linked, and we can see here about 65% of deaths are due to cardiovascular disease. The coronary heart disease deaths increase 2 to 4-fold. Stroke risk is increased by 2 to 4-fold, and heart failure is increased to 2 to 5-fold in the diabetic patients. As the HbA1c is increased by 1%, we can see here the glycemic control and risk of development of heart failure in diabetes is increased. And we can see here the development of heart failure in patients who have diabetes, and in patients who have the risk of the diabetes, and patients who don't have diabetes, they are less have less occurrence of the development of heart failure. Professor Ahmed Shawqi will deal with heart failure and diabetes part, and we go after that to the diabetes, who tackles the risk of vascular disease like coronary heart disease, coronary mortality, and non-fatal MI. And we can see that the patients with non-diabetes have 31% the prevalence of myocardial infarction as the patients with normal glucose metabolism. And the pre-diabetes have the same ratio, 31%, and 7% in the undiagnosed diabetes. The mortality after acute coronary syndrome, as we see here, for patients who have STEMI are very high if compared to patients with no diabetes. And the patient with unstable angina and non-STEMI have higher mortality more than the patients who have no diabetes. And these are the days after the coronary syndrome. We can see here also diabetes affecting stenting, and we can see the restenosis percent in diabetic patients is higher than in non-diabetic patients, and the p-value is very high. The repeat PTCA is higher in diabetic patients, and in patients with no diabetes are less. And the mortality from the fatal MI percent is 88% if compared to patients with no diabetes. And the mortality total death is 5.7% if compared to 2.9% with patients with no diabetes. And Professor Mohammed Salim, Professor of Cardiology, will deal with acute coronary syndrome and diabetes. Then we shift to the patients with stable angina or coronary or the chronic coronary syndrome. As we see in patients with diabetes, they have 5,200,000 patients having angina if they are compared to patients with COPD or chronic kidney disease. So the patients with diabetes have a high incidence of CCS. As we see, the patients with stable angina here have higher rate more than the patient with no diabetes. And Professor Syed Farag will deal with chronic coronary syndrome and diabetes. Then we come to the most important risk factor here, which is dyslipidemia, because every 3 out of 4 diabetic patients suffers from dyslipidemia, as we see, and those patients are heightened here they have 3-4 times as compared to dyslipidemia without diabetes. And we know that the dyslipidemia is the single most important cardiovascular risk factor for myocardial infarction if compared to diabetes. This is 10% to 50%. And we, Professor Ashraf Rida will deal with dyslipidemia and diabetes. And now we have to go for the first speaker, and thank you very much for your kind attention.